Anxiety is a natural emotion. However, it can also cause physical symptoms such as shaking and sweating. Anxiety disorders can affect daily life and can improve with treatment. What is anxiety? The American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. Anxiety disorder can affect daily life and can improve with treatment. According to the Anxiety and Depression Association of America, around 40 million people in the United States have an anxiety disorder. It is the most common group of mental illness in the country. However, only 36.9% of people with an anxiety disorder receive treatment. Knowing the difference between typical feelings of anxiety and an anxiety disorder required medical attention can help a person identify and treat the condition. Anxiety and anxiety disorder. Anxiety is a complex response to real or perceived threats. It can involve cognitive, physical, and behavioral changes. Real or perceived danger causes a rush of adrenaline, a hormone and chemical messenger in the brain, which in turn triggers these anxiety reactions in a process called the fight or flight response. Some people may experience this response in difficult social situations or around important events or decisions. Duration or severity of feelings of anxiety can sometimes be out of proportion to the original trigger or stressor. Physical symptoms such as increased blood pressure and nausea may also develop. These responses move beyond anxiety into an anxiety disorder. There are several different anxiety disorders which can present with different symptoms. Typical symptoms of anxious feelings include the following: restlessness, uncontrollable feeling of worry, increased irritability, difficulty concentrating, sleep difficulties. While many people will occasionally experience these symptoms in daily life, people with general anxiety disorder will experience them at persistent or extreme levels. The Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition, text revision classifies anxiety disorder into several main types. In previous edition of the DSM-5 text revision, anxiety disorder included OCD and PTSD as well as acute stress disorder. However, the manual no longer groups these mental health difficulties under anxiety. Generalized anxiety disorder. The chronic disorder involves excessive, long-lasting anxiety and worries about non-specific life events, objects, and situations. Generalized anxiety disorder is the most common anxiety disorder, and people with it are not always able to identify the cause of their anxiety. Panic disorder. Brief or sudden attack of intense terror and apprehension characterize panic disorder. These attacks can lead to shake, confusion, dizziness, nausea, and breathing difficulties. Panic attacks tend to occur and escalate rapidly. Panic disorders usually occur after frightening experiences or prolonged stress, but may also occur without a trigger. Specific phobia. This is a fear and avoidance of a particular object or situation. Phobias are not like other anxiety disorders as they relate to a specific cause. A person with a phobia might acknowledge fear as illogical or extreme but remain unable to control feelings of anxiety around the trigger. Triggers for a phobia range from situations and animals to everyday objects. Agoraphobia. This is a fear and avoidance of places, events, or situations from which it may be difficult to escape or where help would not be available in emergencies. People often misunderstand this condition as a phobia of open spaces and the outdoors. A person with agoraphobia may fear leaving home or using elevators and public transports. Selective mutism. Some children experience this form of anxiety in which they cannot speak in certain places or contexts, even though they may have excellent verbal communication skills around familiar people. Social anxiety disorder. This is a fear of adverse judgment from others in social situations or of public embarrassment. Social anxiety disorder includes a range of feelings such as stage fright, a fear of intimacy, and anxiety around humiliation and rejection. Separation anxiety disorder. High anxiety level after separation from a person or place that provides feelings of security or safety characterize separation anxiety disorder. Separation anxiety is most common in young children but can affect people of all ages. Causes. The causes of anxiety disorder are complicated. Many might occur at once, some may lead to other, and some might not lead to an anxiety disorder unless an other is present. Possible causes include environmental stressors such as relationship problems or family issues, genetics, medical factors such as disease symptoms or the effect of a medication, substance withdrawal. Treatment often consists of psychotherapy, behavioral therapy, and medication. Sometimes alcohol dependence, depression, or other underlying conditions require treatment before treating an anxiety disorder can take place. Self-treatment. Sometimes a person can treat an anxiety disorder at home without clinical supervision. However, this may not be effective for severe or long-term anxiety disorders. Prevention. There are ways to reduce the risk of anxiety disorders. Remember that anxious feelings are a natural factors of daily life and experiencing them does not always indicate the presence of a mental health disorder. People may benefit from the following: reducing caffeine intake, checking with a health professional before using over-the-counter or herbal remedies, maintaining a balanced, nutritious diet, keeping a regular sleep pattern, regularly exercising, avoiding alcohol, cannabis, and other recreational drugs.